Janet Smith is a 12 years old female that presents to the clinic with a complaint of abdominal pain. She's feeling sick of the stomach all the time and she wants to puke everywhere. The pain started after the school started and it started slowly and it's getting worse. It's dull, constant, and all day long. Some days are better, some days are worse, and she's feeling like she's going to puke all the time. There is no aggravating or relieving factor. She takes Tylenol as needed to control the pain, which is not doing anything. And she raised the pain 6 out of 10. The pertinent negative, the pain started. Pertinent positive, the pain started after school started, it's non-localized, it's all day long, and it's associated with nausea and headache. The patient has also sleep difficulties and some stressors such as a classmate picking on her. The pertinent negative, the patient denied patterns of diarrhea and constipation, mucus on the stool, no distension, negative for morphine signs, and negative for psoas signs. The patient is not taking any prescribed medication, only takes PR and Tylenol. And she denies any pet, seasonal, or environmental allergies, as well as recent or past hospitalization or surgeries. She is in 6th grade. She lives at home with mom and dad and brothers and sisters. She feels safe at home other than complaining of the school, having a classmate picking on her. She is not doing any recreational drugs, tobacco, smoking, alcohol, and all her vaccines are up to date. During the assessment, all the vital signs were within normal limits, but she had pain, rating at that time of the assessment 4 out of 10. The labs that I would order are CBC and CMP, and some of the differential diagnoses are irritable bowel syndrome because she's complaining of abdominal pain, and celiac disease because of the abdominal pain. And also functional abdominal pain syndrome, which I gear towards that diagnosis. Why? Because she is not in acute distress. She's having abdominal pain for at least 2 months and is linking to headache, vomiting, fatigue, and stress. Also, she has loss of daily functioning. She has a sleep problem that are consistent with that diagnosis. Especially all the symptoms are related since the school started. And having a friend that is a possible stressor. All the clinical finding makes this diagnosis more likely. Plan. I recommend taking probiotic for 7 days to prescribe citalopram, Celexa as it achieves benefit from the anticholinergic effect, such as reducing GI motility and visceral sensitivity, as well as improving sleep pattern. Non-pharmacological, I will acknowledge the pain because the pain is real for the patient, even though there is no significant findings on the lab test or any other test that I might order. Labs. The patient will also benefit from CBC to rule out anemia, for CMP to check electrolytes in the setting of the frequent diarrheas, C-reactive protein, fecal calcoprotein to rule out IBS. She also will benefit from H. pylori testing to rule out any other possible infection that might be related to the symptoms that she is presenting. Just to rule out, and also the celiac panel to make sure she doesn't have any lactose intolerance causing the dyspeptic syndromes. I will teach her coping mechanism, how to deal with the stress at school, such as ignoring the friend, walking away, painting as an encouraging expression of feelings, taking a food diary to see if there is any food that is associated with the symptom whenever she eats, and teaching about sleep hygiene, especially if she's having sleep difficulties, such as avoiding screen time close to bedtime and caffeine drinking to avoid as part of a sleep hygiene. Cultural behavior, I ask the parents if she has any cultural belief that may affect in the caring, any tea, any herbal tea that may be useful for abdominal pain. Regarding to her culture, the patient denied anything. I will teach the patient to recommend the HPV vaccine, another catch-up vaccine, teach self-breast exam, especially if she already had a menarche, avoid or limiting TV, computer, and screen time, and doing healthy exercise and healthy eating. Referral. I will refer the patient to a psychiatrist for cognitive behavioral therapy, relaxation, mindfulness therapy, and other therapies that may be helping her with dealing with the stress at school. And I will follow up in 4 weeks to assess the adherence to the medication I order and also to the adherence for the referral recommendation.